Good afternoon. I'm talking to Dr. Richard Schaffer, radiation oncologist who treats patients with Dupuytren and Ledderhose. Richard, can you tell me, how does the patient's age influence whether you can do radiotherapy for them or not?
Thanks, Anna. So there are a number of issues here. The first one is, does radiotherapy work better at a different age? And the answer is pretty simple, no. I mean, if you've got disease that is active, then it shouldn't be associated with age. It doesn't matter whether you're 40 years old or whether you're 70 years old. You know, if it's going to respond, it would respond. However, there are different patterns of disease in different ages. So we know that patients who get disease under the age of 40, particularly if they have other risk factors, for instance, a family history or having it on both hands or having it on hand and foot, have what's called a diathesis. In other words, more likely for their disease to progress and cause problems. So in that way, someone who's younger would have more advantage to getting radiotherapy. So that, I would say, would be the advantage to treating someone who's younger. However, the disadvantage to treating someone who's younger would be that they have many more years to live, which is a good thing, of course, but they have, therefore, many more years to get side effects. And so when we talk about the side effects, many of which are very minor, so things like dryness of the skin and that sort of thing, you know, for most people, those aren't going to be a major issue. Although if you have those, you know, dry skin for 50 years, then of course, you know, you might have a different view. The one I worry about, however, is the risk, the very small risk that radiation has of inducing a type of skin cancer in the area that we treat. Now, what we know is that for a 50-year-old, the risk is probably somewhere in the region of 0.02% to 0.1%. So roughly 1 in 5,000 to 1 in 1,000 lifetime risk. And that's a risk of getting a skin cancer in the vast majority of people, if it happened, which is a very low risk, that it would be a type of skin cancer that doesn't spread in the body. So, you know, it's important to know about, but a very small risk. Now, the older you are, fewer years you have to form that skin cancer, and therefore the less risk there is of forming that skin cancer in your lifetime. But conversely, the younger you are, the more years you have to live, and therefore you have an increased risk. And so if you weigh that up against the increased advantage of having radiotherapy, there's also a slightly increased risk of getting cancer. And so we need to weigh those things. Now, for someone who is an adult, then, you know, that really needs to be assessed on an individual patient basis. But let's put some rules down. I don't treat children with this disease. In my view, anyone certainly under the age of 18, there's just too much risk. And, you know, children do have a different propensity to get cancer from radiation anyway. Some people say that you shouldn't treat under the age of either 30 or 40. That's in some national guidelines. And I think, you know, the useful thing about that is to give some sort of framework of what's reasonable. So at least you know if you're treating over those ages, it's reasonable. My own view is that if we're treating adults, then we just need to weigh up the risk of one, you know, the risk of the side effects with the advantages. And of course, the risk of not doing treatment is an important thing. And of course, the other thing is the risk of alternative treatment. So the risk of not doing radiotherapy may well be increased risk of needing surgery. Surgery has risks, and, you know, you need to offset those things. So, you know, these are complex decisions. And personally, when I have patients who are under the age of 30 or 40, I think, you know, these are decisions that have to be very personalized. On the other end of the scale, if you get someone who's very elderly, and, you know, really the Dupuytren's disease isn't really affecting them very much, and they're ill with many other things, then of course it might be that treating the Dupuytren's disease is much less relevant in terms of their quality of life. So, you know, there's sort of issues on both ends of the scale. So age, I would say, is an important factor, particularly when patients get younger, but just another factor to put into the mix.
Thank you.